Hello everyone, my name is Dr. Vishal Kole. I am one of the consultant neonatologists at Rainbow Children's Hospital, Visakhapatnam. Today I am going to talk to you about developmental dysplasia of hip. This is a condition of hip joint in babies where the hip doesn't develop properly. It is essential for the wall of the thigh bone to be developed properly inside the socket of hip joint so that the children will be able to move properly later on. In conditions of developmental dysplasia of hip, children at a later age will develop problems like limp or difficulty while moving. They can have osteoarthritis of hip as well as back at an early age, and almost 28% of the children having developmental dysplasia of hip need early hip replacement therapy at somewhere around 40 to 50 years of age. So it is essential to diagnose developmental dysplasia of hip at an early age and preferably after the birth itself. There are some conditions where the developmental dysplasia of hip can be commonly found in situations like twin pregnancy, where one of the babies is a breech presentation, in cases of girl child, in cases of family history of developmental dysplasia of hip. The condition can be identified by simple examination measures at the time of birth or immediately after birth. There can be a requirement of ultrasound of hip joint somewhere around 4 to 6 weeks of age, which can clearly tell you whether there is developmental dysplasia of hip or not. If identified, developmental dysplasia will need a proper treatment by orthopedician, where they can put specialized Pavlik harness which can put the joint in proper position for the joint to develop properly over the course of time. Out of 100 children having developmental dysplasia of hip, only 5% of the children will need some form of surgery. It is very essential to identify this problem early and treat it properly. So, after birth, please make sure to ask your neonatologist to check for developmental dysplasia of hip. Thank you.